Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell Eleanor Blum Patient Family Learning Center at Mass General. Today's program is part of our Climate Change and Health series, a special collaboration between the Blum Center and the MGH Center for the Environment and Health, as well as the MGH Institute of Health Professions Center for Climate Change, Climate Justice, and Health. Before I get started, I just want to go a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you are in listen-only mode. Everyone has been muted so we can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical questions or comments in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. So next, I would like to introduce you all to today's guest speaker. Joining us today, we have Dr. Suellen Breakey. Dr. Breakey is the Associate Director of the Center for Climate Change, Climate Justice, and Health, and a Distinguished Teaching Associate Professor in the School of Nursing at MGH Institute of Health Professions. She teaches in the Doctor of Nursing practice and Accelerate BSN programs. Her clinical background includes cardiac surgery, critical care, hospice care, and global health nursing. For over 10 years, she was a leader with Team Heart, a nonprofit organization that provides RHD screening, cardiac surgical care and follow-up, and patient provider education in Rwanda. Her scholarship interests include the impact of climate change on human health and well-being, bioethics, and global health ethics. Dr. Breakey is a co-author of Global Nursing in the 21st Century, which was published in 2015. She co-chaired the National League for Nursing's 2022 Vision Statement on Climate Change and Health. Dr. Breakey has published widely and presented locally, regionally, nationally, and internationally. She joins us today to give a talk on climate change and vulnerabilities of pediatric populations. But before we turn it over to Dr. Breakey, Dr. Patrice Nicholas, would you have a few words you'd like to share with the audience?
Thank you, Amy. And thank you, Suellen, our Associate Director, esteemed Associate Director of the MGH Institute Center for Climate Change, Climate Justice, and Health. We're very fortunate to have nursing leadership on climate change and health, as well as more broadly, health professions leadership on climate change and health. We, with the partnership with MGH and the Blum Center, and also the MGH Center for the Environment and Health, in addition to the Blum Patient and Family Education, Climate Change and Health Education Series, we have monthly webinars with the Center for the Environment and Health. On Wednesday, February 21st, we'll have a session with Dr. Victor Zhao, who's the president of the National Academy of Medicine, talking about climate change and health and the future of the National Academy. We'll send that link to Amy so that she can distribute it. And without further delay or ado, we welcome Associate Director Suellen Breakey.
Thanks, Patrice. And I don't know, Patrice, if you mentioned or Amy did, but Patrice is our esteemed director of the Center for Climate Change, Climate Justice, and Health. So she's my good friend and colleague. Okay. Can you see my screen? Okay, let me just put it into. Okay, there we go. So, welcome everybody. As Amy mentioned, today we're going to be talking a little bit about climate change and the vulnerabilities specific to pediatric populations. And we're covering, I would say, the span of pediatrics from very small to adolescents and young adults. And I'm going to talk a little bit about some prenatal health outcomes that impact children as well. So in terms of our objectives for the day, we'll identify environmental, developmental, and social risk factors that make kids more susceptible to both physical and mental health impacts related to climate change. We'll describe the impact of climate change on child health and discuss broadly some strategies to mitigate these health impacts of climate change on child health and well-being, I might add. So this is a just kind of a good overarching look at how and why climate change is one of the greatest public health and health equity challenges of our 21st century. And this is from, I think it's from the 3rd National Climate Assessment. The 5th National Climate Assessment just came out a few months ago, and I have a link in the slides, but you can also, if you Google that, it provides kind of like a very comprehensive look at what's happening specific really to the United States in terms of climate change. But you can see here, this kind of points out what the climate drivers are. So increased temperatures, precipitation extremes, extreme weather events, and sea level rise. And these are then creating exposure pathways, which we all have different levels of vulnerability to. And these include extreme heat, poor air quality, reduced food and water quality, changes in infectious agents and vectors, and population displacement. And then these are situated in an environmental and a social context, which then impact our ability to be resilient and adapt to these changes and how these impact our health. And so in terms of environmental and institutional contexts, we are looking at land use change, ecosystem change, the conditions of our infrastructures, particularly in those areas where infrastructure is already weakened, geography, impacts are different by region, and even within cities, they can be very different. Agricultural production and livestock use. So these are all contributing to or impacting how we respond to these impacts. And then social behavioral context, age and gender, race and ethnicity, poverty, housing and infrastructure, education, discrimination, access to care, community health infrastructure, and having pre-existing conditions. And what we have here is listed some of the health impacts. This has actually been expanded since this was first published in 2016, but we have heat-related illness, cardiopulmonary illness, food, water, and vector-borne disease, mental health sequela, and also pregnancy outcomes. So both for pregnant people, but also for fetal development and infants born, and depending on their exposure to some of these pathways, particularly heat and air pollution. So why are kids so vulnerable to the impacts of climate change? And there are, as I mentioned, different factors. So developmental and physiological risk factors, environmental risk factors, and social risk factors. And so this is kind of like a reimagining of the slide before. But when we, as I mentioned, when we think about developmental and physiological risk factors, there are different risks and impacts depending on the age of the child. And so again, I kind of looked at this for this purposes of today from prenatal impacts that will then impact, a child that is born, infant childhood exposures, and adolescent and young adults. In terms of environmental risk factors, and I should also say that there are certain populations that are more at risk because of their vulnerabilities. So for instance, people who have more exposure to air or land pollution, these are often sometimes in rural settings, but oftentimes in urban settings, particularly areas that have previously been historically redlined. And that was for those of you who might not be familiar with redlined, historical redlining, this was a policy, an actual practice and policy of deciding what areas were most desirable to live. And the areas that were considered not desirable to live were redlined. Like it was literally lined in red. And these were often areas, communities of color, and low socioeconomic communities. But in terms of the communities of color, oftentimes these were very vibrant communities that were subsequently disinvested in. And so they are areas for a lot of, these are areas that often are near major highways. They might have toxic waste sites. They have a lack of green space and tree cover. So they are vulnerable, their exposure to air pollution and heat are disproportionately higher, and then that impacts health as well. These are often areas too where kids have really high rates of asthma and ER admissions for asthma-related issues because of the air pollution, both indoor and outdoor where they live. Engagement in outdoor activities. So kids who engage in athletics, they're really at risk for heat-related illness. And most schools and athletic organizations have heat plans because they're aware of this risk for heat-related illness. And then kids are also, they just have a longer exposure over time. Older adults, as these impacts of climate change get worse, it's going to impact younger people disproportionately just because of the length of their exposure. Social risk factors include, as I mentioned earlier, low socioeconomic status, marginalized communities, children who rely on other people to keep them safe, can be impacted by parental stress, displacement and interruptions in education put kids at risk, food insecurity, and recognition of the actual and significant threat of climate change. And we're going to be talking about both physical and mental health impacts. Kids are their mental health is very impacted by climate change, and we'll talk about that. Groups that are particularly at risk also include people who are experiencing homelessness, people living with disabilities. And so this applies to kids as well. And, that also, again, kids with disabilities are very reliant on their parents. So the physical impacts include air pollution, and air pollution comes from two main categories, and that's particulate matter and ground level ozone. And I'll talk about that in a minute. But what we do know is that there's an increased incidence of asthma in kids, not only an increase in the number of kids who are getting asthma, but also the frequency and intensity of these asthma attacks, 5 million kids in the United States. And it's really important to note again, as we talk about all of these impacts, we have to do it from an equity lens, a climate justice lens, and an environmental justice lens, because the people who are most impacted are the people who are contributing the least to greenhouse gas emissions. And they're also the people who have also, their lives and their health have been impacted by structural racism as well. Fetal lung development is impacted by air pollution. And there have been studies that have shown this to be true. And also, most probably issues around neurodevelopmental issues like autism and ADHD, for instance. I think the science isn't as clear about that, but there's a feeling that these also, that air pollution contributes to these health impacts as well. So this is on the left here, just for your kind of, so we're all on the same page. If you're not familiar, when we think about particulate matter, you know, this comes from combustion, it comes from organic compounds, it comes from wildfire smoke. We felt that and we witnessed that last summer very significantly. So these are very, very small particles that measure 2.5 microns or smaller, and they can't be seen by the human eye. They're very small. PM10 is dust, pollen, mold, so a little bit bigger, but still pretty small. And then you can see how they compare to the size of a human hair, which is also, you know, you can see it, but it's fine, and a grain of beach sand, which is very small. So the issue with particulate matter is it can get down deep into the lungs. It can cause significant damage to the lungs, but it can also cross into the bloodstream and also into across the placenta into the fetal, into the you know, fetal lung circulation. And so this is why it's both harmful to fetuses, but also to everybody. And we're talking about kids. And so the main focus is around respiratory diseases, but just as a point of reference, in adults, it's also responsible for cardiovascular disease, stroke, MI, you know, other kinds of diseases, and often under-recognized. Ground level ozone is a combination of sun and chemicals that are the byproducts of like industrial activity. And so on hot days, the heat and the sunlight combine with what's called these volatile organic compounds, and it creates ground level ozone. And so this is also not good for our health and can also contribute to respiratory issues as well. So this is, you know, so there may be less ground level ozone, let's say in the wintertime, but particulate matter is always an issue. And again, that can be indoor or outdoor. And so, you know, there are ways parents and children can protect themselves. And there are things that they can do both on the inside and the outside. So during summer or during times when we know that the air quality is bad, kids who have asthma should try to avoid going out during those times. They should wear an N95 mask that can help to kind of mitigate any kind of asthma exacerbations that they might have. And then on the indoor, things like fireplaces, candles, gas stoves, I think we probably all know, these can also contribute to worsening respiratory symptoms. And this, I just wanted to show you, if you're not familiar, we do get the air quality on our phones these days, but this is airnow.gov is a website where you can go and you can type in the name of your town or your zip code, and it will tell you in real time what the air quality where you live is. It's also a site that has really great educational materials about how you can lessen the effects of air pollution and some of the things that you can do, both again to protect yourself from outdoor air pollution as well as indoor air pollution. And this just points out the 5 different major air pollutants that are regulated and that are monitored. ground level ozone, particulate pollution, like I mentioned, carbon monoxide, sulfur dioxide, and nitrogen dioxide. The other thing that impacts children and young adults is extreme heat. And we know that the world is getting hotter, and last year I think was the hottest recorded on record. So I mentioned prenatal exposure. So women who, or pregnant people who are exposed to extreme heat, and by the way, air pollution, have a higher incidence of preterm birth, intrauterine growth restriction, stillbirth. I mentioned that it impacts lung development as well. So when we think about, sometimes it's hard to disconnect thinking about the mother from the child. The other thing that especially smaller kids and infants have is, they have less of an ability to kind of regulate their internal core temperature. So they're more at risk for becoming dehydrated, heat stress, heat stroke, and also early onset kidney disease. So when people are exposed to extreme heat and they have chronic dehydration, then this can actually cause kidney failure. And this has been a particular issue that is seen in migrant farm workers, for instance, and some of those might be, young adults, and they're seeing chronic kidney disease in younger people who are at risk because of their exposure to extreme heat. But the other population that's at risk that I mentioned earlier is, kids who play in sports teams or participate in other outdoor activities when it's really hot outside. And so that's just something to be aware of. But as I mentioned, I think a lot of formal sports teams have plans in place because they know that this is a major risk for young athletes. Then just to kind of mention some of these other health impacts, vector-borne diseases. So we know that for instance, if we take like Lyme disease, we know that the incidence is expanding, and the vector is expanding and becoming more intense because of rain and warm weather. So this is kind of increasing the lifespan of the mosquitoes that are responsible for these particular vector-borne diseases. Malaria, which is not really endemic to the United States, but last year there were, I think, cases in Texas, I think Florida and Maryland. So, that's just, and in the past, we've seen chikungunya in pregnant women, which impacts, the kids that are born to the women who have these exposures. So seeing vector-borne diseases kind of outside the normal geographic region that we would expect to see them because of the increase in rainfall and heat, etc. Waterborne diseases, kids are already, so just back to the vector-borne diseases. And so children are at risk for these things and susceptible because particularly like West Nile virus, they're either outdoor playing, but they're also, West Nile virus, if a younger, smaller child gets that, they would be more sensitive and at risk for more negative outcomes. Waterborne diseases, children in general are susceptible to diarrheal disease. It's one of the, if not the number one, but a huge cause of mortality globally. So as children are exposed to waterborne diseases, let's say after a flood or a major hurricane, either through drinking water, contaminated drinking water, then they will be at risk for, diarrheal diseases and intestinal symptoms, and would become, more sensitive to that. Food and foodborne illnesses. So in general, climate change is causing what the Lancet Countdown labeled kind of a syndemic of climate change, undernutrition, and malnutrition. And so globally, but also locally, the increased carbon dioxide in the atmosphere, and then which is kind of then going into the ground, is actually changing the nutrient composition of the foods that we eat, and in some cases making them less nutritious. And so that's one way that food is impacted. But additionally, people who are already insecure, may have difficulty in the future getting access to nutritious food. And in addition to that, oh gosh, I just lost my train of thought about food. When in areas where people are unable to actually grow their own food because of saltwater intrusion, for example, or they don't have good quality soil because of the changes, drought, etc. What happens is these people might get imported food, and this imported food is often not nutritious. Things like Spam, things that last a long time but may not be fresh or nutritious. In adults, this can cause undernutrition in the face of obesity. So people can be obese and overweight, but they're undernourished, and this can lead to non-communicable diseases such as diabetes and heart disease. In kids, if they are undernourished and then they're not getting nourishing food, maybe because they don't have access to food in their area, and this is definitely a global issue, then that can create stunting in growth and changes of that nature. The other thing that can happen with foodborne illnesses, so there's the issue around access to nutritious food, and then also contaminated food. And we're seeing more and more, there's a great series on Netflix about this. I wish I knew the name, but I'm forgetting the name, but it's about food safety. So oftentimes you have agricultural areas which are very close to farming areas. So you've got those two things together, and they often share the same water supply. And so this water is then damaging, it's contaminating our food supply. And so that also is kind of impacting nutrition and could impact kids. So it's about the quality and the micronutrient makeup of food. It's about how food is grown and access to food. And then two other things to think about is, in these extreme weather events, the risk of trauma and drowning is also something to consider. So the other big thing that is impacting children, particularly children and young adults, is their mental health and well-being. And this is probably this is getting more recent attention. The physical impacts of climate change more broadly, not just with children, but with adults, is probably been better established. But the mental health impacts are really beginning to kind of come to the forefront a little more. And this is from an article by Vergenst and Berry, but I just liked this this kind of schematic that they create. Well, this it was in their article, but it was published initially from someone else, but looking at the mental health impacts and how as children, as when kids are smaller, they're very reliant on they're both parents, but even when they're in utero, children can be then subsequently influenced by the mother's, as I mentioned before, exposures, environmental exposures, but also the mother's level of stress can impact the fetal, like lead to long-term outcomes that exist even, through lifetime. So if we look at if there are interventions to kind of allow the child to adapt or become more resilient, then you can see on this trajectory that the results in terms of risk is to mental health is lessened. We'll talk more about that. But it's also really important to think about right now in 2024, there are multiple compounding factors for negative mental health incomes. So as we talk about the mental health outcomes specifically related to climate change, it's important to consider the other things that are impacting kids, young adult children, adolescents, young adults. Gun violence is a huge stressor. They're living in a world that we didn't live, at least I didn't live in when I was going to school. COVID-19 has had a huge impact on mental health. Social media, we all know, impacts children's mental health. And even the current geopolitical climate with, the war in Ukraine and what's happening in Israel and Gaza, all kinds of things are impacting or contributing to things that could lead to poor mental health in children. And this was a quote from the newest national assessment, the 5th national assessment, climate assessment. In a US-born children in 2020 are more likely to experience climate-related adverse childhood events from damage to homes, schools, and communities. So an adverse child event is more broadly can include things like childhood trauma, living in a house where, it kind of gets at environmental issues and how this impacts children through their lifetime. And we know when someone has, more childhood events, adverse childhood events in their childhood, this health. And the more ACEs you have, the more at risk you are for health, substance use disorder, poor mental health outcomes. There's a whole range of things that it just points to how important a healthy childhood is for later on in adulthood, a healthy adulthood. So acute impacts, and I'm talking about mental health impacts here, include anxiety, depression, disruption in sleep, post-traumatic stress disorder, and violence, including child maltreatment and trafficking. So these can, the anxiety, the depression, these can lead from anything from, experiencing extreme weather event. Think about these fires and people have to, they lose everything. They lose their home. Their life is disrupted. And so this can really impact kids. The other thing that happens with kids is, I mentioned this earlier, but they are not only reliant on their parents, but their parents' level of stress will then also impact children as well. And there is some suggestion that children have more significant post-traumatic stress disorder than adults do, particularly because they rely on other people to keep them safe. And violence, there's a causal effect between extreme heat and violence. And so that's something that's important to consider when thinking about kids. And again, their particular vulnerability because they're not necessarily independent. And then because we're seeing more and more displacement because of heat, wildfires, extreme weather events, this puts children into a position where they're vulnerable for human trafficking, particularly if their housing's insecure. Chronic impacts include poor outcomes regarding academic achievement. So again, if someone is displaced, if a family is displaced, then they might miss school, they might get moved to a different school, and this can actually impact cognitive development. A loss of social networks is also something that impacts children chronically, and as I mentioned earlier, can lead to more intense post-traumatic stress disorder. So particularly when people are displaced and they're uprooted, and then they lose their community networks and their networks of friends, and this can impact children. Other chronic impacts include solastalgia, and so this is a term that was introduced by Albrecht in 2005, and he describes this as the pain or sickness caused by the loss or lack of solace and sense of isolation connected to the present state of one's home or territory. And so again, I think of these people who are uprooted and displaced because of either what's happening to their environment that makes it no longer livable, or they have to move because of extreme heat. And we're seeing more and more of that, shifting out to the like the Northeast, for example. And it's a sense of homesickness one gets when one is still home, and just this intense understanding that the environment is being kind of destroyed in someone's midst. Indigenous communities are at increased risk for this. And, this is a picture of melting sea ice. And in one of the resources that I have at the end of the slides, there's a quote from an Inuit person that says, "We are the people of sea ice. How can we be the people of sea ice if there is no more sea ice?" Which I think really, it's a very simple statement, but it really underscores, particularly for Indigenous communities, their connection to the land and how that really makes them at increased risk, particularly for mental health outcomes, a sense of self, and this idea of solastalgia. This was from a study that was done, and it just shows sources of solastalgia, essentially, which I just thought was kind of interesting, because even though this was probably done with adults, think about it, kids are, children and young adults are having the same feelings, especially if they're being impacted. So extreme weather events, climate change, environmental transformation, land clearing, resource extraction, changing of the built environment, displacement, violence, war, and industrial development. Ecological grief is another term that has been coined, and this is the loss of nature and ecological surroundings, which can lead to anger, frustration, and hopelessness. And these are feelings that young adults and children are reporting, and which is just really sad. And these, this is just showing some loss of nature. Two other kind of very related terms, but slightly different. are eco-anxiety and climate anxiety. And so eco-anxiety often refers to that larger ecological crisis, and climate anxiety refers specifically to climate change. And the feelings associated with this include worry, fear, grief, despair, guilt, shame, and also hope. And as I mentioned earlier, and anger. So this was a study done, it was an international survey by Marks and colleagues. They surveyed 10,000 young people ages 16 to 24. So not quite a completely pediatric population, but I think still important nonetheless. 60% of those who were surveyed felt very or extremely worried about climate change. Greater than 45% indicated their negative feelings impacted their daily lives, and 77% indicated that the future is frightening. And this was an international survey, and those who live in the global south, in less resource countries, had felt these feelings more frequently than those living in the global north or more resource countries. And then this was done specifically in the United States. So similar age group, 16 to 25. And this is the how worried are you about climate change? So 20%, extremely worried, 29% moderately worried, 27% very worried, 14% a little worried, 9% not worried. So you can see that a large number of this group are worried, and I think that's a pretty good indicator of how children and young adults are feeling. So this is kind of a combination of two more studies just to kind of bring home the message that young people are really, really impacted by climate change. They feel troubled about the state of the world and the future. Younger generations actually worry that the world will end in their lifetime. These are findings from one study. And they can experience confusion, betrayal, and abandonment related to adult inaction, which I think this is a really, really important point, is that kids who don't have the ability to actually act, i.e., vote, think that adults and the government are failing at this, at addressing climate change. And this can lead to moral injury. So in other words, this is like becomes a moral issue to them, which can be detrimental. So just to end with, and then we'll maybe have some time for questions, but just in terms of strategies to increase resilience in children and young adults, get them engaged or encourage their engagement in ways to individually address climate change, either through advocacy or through practicing sustainability. I have a friend whose daughter, who's a teenager, is the household sustainability manager. And, she's really passionate about the environment and protecting the environment. And so she really takes the lead in that household. And so I think by encouraging children and young adults to take action, it can increase their mental outlook on the issue and provide a little bit of hope where despair and eco-anxiety or climate anxiety can be replaced by hope and action. The other thing is, it's good to be outdoors when the weather is right. It's good to be outside, being in green spaces, being where there's grass and trees is good for our mental health in particular, but it's also good for our health to get out and be exercising. It's important for our mental health. And so encouraging these things is important. I should also just note, as I mentioned, when we have to look at this through an equity lens, many of these urban areas lack green space. They lack trees and grass. And so there are a lot of groups or organizations that are kind of developing programs to bring kids who are living in urban heat islands out into more natural settings where they can experience, nature, because we know that that's good for health. The other thing you can engage your, kids in is to help establish a family emergency plan. There's lots of sites online that can help you set that up. And knowing that we have much more, we have many more extreme weather events, and those are only going to continue. Having an emergency plan for the family that includes communication, as well as, items that you should have in your household, is one way to engage children as well. And then from a healthcare standpoint, really thinking about, we all should be, and this is happening more and more, but really regular screening as part of the health, the wellness visit, to incorporate, both what are a child's risk, not only for mental health impacts, but physical impacts as well. What are the environmental and structural and social determinants that are impacting their ability and their family's ability to become resilient. And then education and prevention strategies, making sure that, children know what their own health risks are, with this, particularly as they get older, so they know if they have asthma, for instance, that it's not a good idea for them to go out on a really hot day, hot, humid, smoggy day. Youth climate education programs are something that we're seeing more of. And then, really systems level change, which is much more complicated to get into here. And then this is just, I love this picture because it's a couple of years old, but it does, I want to leave you with, well, it's not fair that children and young adults are going to really be left with this major problem and bear the burden of it, as is future generations, or as our future generations. There is hope because they are advocating. They're getting out there, they're using their voice. This is a picture from one of the climate protests a few years ago. And, young adults and children, they understand this issue pretty well. And I think they are kind of the answer to our future. So with that, I'm going to stop sharing my screen, and if there are questions.
Thank you. We are now at the end of the session. If you have any questions, feel free to enter them in the chat. Do you have any recommendations for families with children who live in areas close to the highway where they're exposed to more pollutants in terms of spending more time outdoor?
I mean, that's a tough one. We're located in the Charlestown Navy Yard, but we're right under the Tobin Bridge, and there, that's an area that is highly populated. It has, the Bunker Hill housing development. It's that balance of getting out. I mean, I think if possible to try to, if there are parks that, kind of going outside further away from the highway, particularly with kids with asthma. The other option is, if a child does have asthma, to have them wear an N95, which is not very fun for a child to be playing outside with an N95 on.
Thank you. And how would one check how nutritional the food is like for fruits and vegetables? Are there certain stores who have good food versus just any fruits and veggies?
So this isn't really it's more at the micronutrient level. So it's not necessarily how the food is being grown, but it's the changes to the soil as the result of increased carbon dioxide. That's what's changing the nutrient of the food. So I don't know if there's a way to really check that. Just something to be aware of. I think, you know, it's just also important to think about that the other issue is really the food distribution, and that could become an issue. And so thinking about, you know, that for families that are already in food insecure, that could become a larger issue in the future.
Thank you. Can you share the socio-political challenges of climate migration and child health? For example, at our southern border, increased heat in Central America and loss of the ability to farm drives the migrant crisis and impacts children.
Sure. I think we often think of, let's say, what's happening at the southern border. We think of that we don't necessarily equate that with climate change. And I think that question was from Patrice, and I'll let her chime in as well. But there's a really good series that was done in the New York Times about the climate migration. And so these people, you know, it is the threats of violence, but it's also the changes to the land. So there could be, you know, intense rain and flooding followed by drought, followed by flooding. And so what happens is these people aren't able to sustain their livelihood, because if they're farmers, for instance, and they don't have crops and they can't sustain their livelihood, that makes them more susceptible to the gangs and violence from that direction. And so then people are fleeing because they can't protect themselves because they don't have economic stability. What I will also say too is that I had a DNP student who works at the southern border, and she did her DNP project on kind of looking at the issues, kind of like assessing the program. It's actually through MGH Global Health. But she talked about one of the biggest issues at the border, which they are exposed to even heat and, you know, intense heat down there because it's in, you know, Texas, but is there are a lot of pregnant women. And she sees a lot of pregnant women when she's down there practicing. And I, you know, think of that there are, think of the risk that those women are incurring because they're pregnant and they're in this high heat and they're really not getting much in the way of medical care or shelter, for that matter. Patrice, did you want to?
I think you covered it, Suellen. Thank you. It is challenging because it's seen as an issue of they aren't these aren't citizens of the United States and they're coming in illegally, when they're really driven by a lot of climate change impacts as well. And children experiencing loss of place, loss of educational opportunities, loss of health care are really challenging. So thanks.
Yeah, and children who are exposed to heat in general, you know, the cognitive delay that can cause impacts them again for their life trajectory. That will influence their quality of life, their economic opportunities as well. And the other thing I just wanted to say, I touched on it, but when we think about non-US citizens who are living in the United States, they are also very susceptible to heat. And again, many of them are younger, they're not older, and they're, you know, migrant farm workers, for instance. And so not only are they developing this chronic kidney disease, but they have higher rates of morbidity and mortality, death rates related to this as well.
And are there any online resources one can go to learn more
About
this or any other like impacts on children related to climate change?
the airnow.gov that I mentioned has great resources around asthma. There are a lot of resources. I think, the EPA in general has some great resources. The American Heart Association has great resources. Trying to think of others. There's just a lot out there, and I think, if people are like kind of interested in a particular risk, then there's just a lot out there. I know I'm not being very specific, but with kids, the first thing that I think of is asthma. But like I mentioned sports, there are a ton of resources around sports and heat.
You brought up a great point about the mental health impacts. As parents and caregivers, how can we check in on our children, how they're doing?
I think be open to have the conversation. Ask. Like I said, I would also say just try to engage with them in some kind of, action, even if it's small. It always feels better to be acting than just to be worried. It displaces that worry, gives them something else to focus on. Acknowledge that this is okay to worry. The other thing that it's important to note is that, and Patrice put something in the chat, but the American Psychological Association, along with Eco America, put together a whole big booklet about the mental health impacts of climate change for everyone, kids, women, all kinds of different, groups of people, which is also through an equity lens. And oh gosh, I just forgot my train of thought. What was I saying before that? It was a good thought too that I had about kids. I lost it, but that is a good resource actually, because it has a lot of information in there. Oh, I know what I was going to say. The important thing too is that it's not pathological to be worried about the environment. So it might be that, maybe a child feels sad or stressed out about this. I think to kind of give them the message that it's okay to feel that way. Of course, you still want to try to get them to move beyond that a little bit, but it's not, they don't have something wrong with them for feeling this way about what's happening to our world.
Thank you. I think we're about at time. Before we end today's session, do you have any final thoughts you'd like to share with the audience?
I just think educating yourself about these health impacts, kind of understanding what your risk is. Like I said, there are a lot of great resources out there. And just try to take advantage of those resources. Patrice, do you have any last words?
I think you've really covered it all, Suellen. I think the focus on both physical health challenges in a climate changing world and mental health were great. Unfortunately, important to consider as the planet heats up.
Thank you so much.
And also your message of hope, that hope is an important part as well. Excuse me, Amy.
Absolutely. Thank you so much for spending the hour with us. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. And Patrice shared a few resources with us in today's chat. You're welcome to save the chat, or if you'd like a copy of those resources, feel free to email the Blum Center at pflc@partners.org, and I'd be happy to share that with you. I'll also enter that email in the chat as well. All right. Thank you so much, everyone. Have a lovely rest of the day.
Thank you.